Hi everyone, my name is Dinesh Surasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I'm here to share with you some of the things that I've learned along the way. Today we're going to be talking about imaging the supraspinatus tendon. As with previous talks on the shoulder, I really recommend two resources. The first is the ESSR guidelines on shoulder imaging, and the second is the website ultrasoundcases.info. Both are invaluable, one for learning about ultrasound imaging and the other for learning about various pathologies and how it might look. Here is the image from the ESSR guideline on how to image the supraspinatus tendon. The subject sits with their hand placed on their back pocket and the shoulder is slightly adducted. With the transducer placed over the tendon in a long axis, with basically the distal end facing away from the belly button, you can see on the ultrasound image below that the supraspinatus tendon, as it attaches onto the greater tuberosity, looks like a bird's beak. Overlying, we have the deltoid as well. If we turn the transducer 90 degrees so that the distal end is pointing towards the belly button, we can then see the supraspinatus tendon in the short axis view. Medially, you'll have the biceps tendon, and as you move laterally and posteriorly, you will come across the infraspinatus. Again, here in the ultrasound image, we can see the supraspinatus tendon, we can see the bursa overlying it, and above that we can see the deltoid muscle. In clinical practice, however, you can also orientate the patient or the subject that you're scanning in different positions. Sometimes I have the patient sitting upright with the hand on the back pocket, like in the SSR guidelines. But quite often I have them lying on their side with their hand on the back pocket again. This confers a little bit more stability and comfort to the patient, and also means that you have a little bit more control when you're undertaking your imaging and your interventions. Whether the subject is seated or lying down, the orientation of the transducer will be the same, whether you're examining the tendon in a short or long axis. It's important to have a firm grip of the transducer, and it's useful to place either two fingers or the heel of the hand on the patient. This confers a lot more stability, and if you want more information on how to handle the transducer, please have a look at my previous video. Here are some examples of the supraspinatus tendon in a long axis view taken on two different machines. As described in the ESSR guidelines, it has a bird beak appearance, with the bursa sitting over it and the deltoid sitting above it as well. Similarly, here are some examples of the supraspinatus tendon in a short axis view. On the left, we see the bulk of the body of the supraspinatus tendon as it sits over the humeral head, and we often describe it as having an appearance like a tire on a wheel. If we look at the right image, it has a little bit more of the biceps tendon in view, and medial to that will be the subscapularis. So here we're seeing a bit of the rotator interval. In both images, we have the bursa and then the deltoid sitting above the tendon. Here's an example of a partial tear to the supraspinatus tendon. On the ultrasound image, it appears to be an articular-sided tear. And in this situation, you will often see the articular surface much more clearly. In order to have a more accurate estimation of the size of the tear, it is important to view the tear in both the short and long axis. Here's an example of a complete tear of the supraspinatus tendon. Instead of the normal tendon architecture, you see a few straggles or remnants of the tendon and a large amount of fluid sitting in the bursa. It's evident from both the short and long axis views. I hope you enjoyed the video and you've learned something that you can use in your clinical practice, particularly when undertaking ultrasound imaging and guided interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. Remember, you can also follow me on Twitter and Instagram. I hope to see you all very soon, so take care and bye for now.